California is receiving and reserving now about 40% of all the vaccine that we receive here in this state for the most disadvantaged neighborhoods. The goal here is to get those vaccinated who are most at risk. And NBC4's Gordon Tokumatsu now has more on the vaccine rollout.
Dr. Alfonso Torres-Cook is the epidemiologist at Beverly Hospital in Montebello. He says the will is out there in communities like this one hit hard by disease and death, but the way is a different story.
They don't have transportation for once. The majority are elderly people. They don't have access to computers, and there is no Wi-Fi.
During the height of the holiday surge, 79 beds here were occupied by COVID patients. To put that into perspective, the entire facility only has 202 beds.
That's the problem that we have with these communities.
Cindy Loya of Pico Rivera came down with COVID-19 on Christmas Eve. So ill she was bedridden for 2 weeks. But did she consider going to a super site to be vaccinated, maybe Pomona or Dodger Stadium?
I didn't want to do that, but
why not?
It's just far.
Ryan Garcia was never infected, but many were in his Hacienda Heights community.
And some of my cousins, I actually lost a couple of my uncles.
We also asked him about going to a super site.
You know, as far as like large gatherings and stuff, I'm really not one to go to those.
So now Montebello and communities like it will be receiving as much as 40% of the state's entire vaccine supply. Hospital officials are hoping the estimated 2 million doses from the state's supply will be a game changer from East LA to Pico Rivera and beyond.
I live here, so I'm happy that the people I know and love are going to be able to have access to it.
In Montebello, Gordon Tokumatsu, NBC4 News.